Standing in front of the bathroom mirror, maybe after a shower, and your eyes stop on a small dark spot on your arm. Or your back. Or your leg. You lean in a little closer. You tilt your skin toward the light. And you ask yourself a quiet question. Has this always been here? Did that mole just get bigger? Should I be worried? I want you to hold that feeling for just a moment. Because that feeling, that tiny pinch of doubt, is exactly where this conversation needs to start. Over the next half hour, we're going to talk about something that affects millions of people over the age of 60, yet very few understand clearly. The difference between a harmless mole and a dangerous melanoma. This is not a topic for doctors only. This is a topic for you. For your skin. For your peace of mind. Let me begin with a story. Not a made-up story, but one that comes from the pages of a book called The Melanoma Letter, published by the Skin Cancer Foundation. In that book, they describe a man named Robert. Retired. Active. Loved gardening. In his late 60s, he noticed a spot on his shoulder that looked like a dark freckle. It didn't hurt. It didn't itch. He thought, it's just an old mole. I've had moles forever. 2 years later, that spot had grown into a wound that wouldn't heal. By the time he saw a dermatologist, the melanoma had already spread to his lymph nodes. Robert survived, but the treatment was brutal. And his first words to the doctor were, "I wish someone had shown me the difference sooner." That's what we're going to do today. I'm going to show you the difference. Not with complicated medical drawings. Not with scary terms you can't pronounce. But with simple, clear, unforgettable pictures in your mind. Let's start with the mole. A normal mole, in medical terms a benign nevus, is like an old friend. It shows up sometime in childhood or young adulthood. It's usually round or oval. The edges are smooth and clear, like a circle drawn with a steady hand. Its color is even tan, brown, or sometimes a little darker, but the whole mole shares the same shade. Most moles are smaller than the size of a pencil eraser, about 6 mm across. They sit quietly on your skin for decades. They don't change. They don't demand attention. And here's something comforting, the average person over 60 has between 10 and 40 of these little spots. Most of them will never cause any harm. But melanoma is different. Melanoma is a wolf in sheep's clothing. It starts in the same cells that make moles, melanocytes, the pigment factories of your skin. But something goes wrong. Maybe from years of sun exposure. Maybe from a very bad sunburn in childhood or young adulthood. Maybe from genetics. Those cells begin to grow without control. And that's where the danger begins. I want you to remember a simple word. A word that could save your life. The word is ABCDE. No, not the alphabet song. This is a tool that every dermatologist uses, and now you will too. Let me walk you through each letter, slowly, like a map. A stands for asymmetry. Imagine drawing a line straight through the middle of a spot. A normal mole is symmetrical, both halves look roughly the same. Like a perfect circle or an oval. But melanoma, one half does not match the other half. It's shaped like a blob. If you fold it in half in your mind, the two sides are not the same. That's asymmetry. B stands for border. A harmless mole has a smooth, clear border. You can point to where the mole ends and the normal skin begins. But melanoma has an irregular, jagged, or blurry border. It looks like a coastline with bays and inlets. The edges might fade into the surrounding skin, almost like a stain spreading on a paper towel. C stands for color. A normal mole is one color, all the way through. Light brown, dark brown, or sometimes black, but uniformly one shade. Melanoma, however, is a mixed bag. You might see tan, dark brown, black, red, blue, or even white patches all in the same spot. It looks like someone took different crayons and scribbled over the same area. That uneven color is a loud warning sign. D stands for diameter. While many moles are smaller than a pencil eraser, melanoma is often larger. But here's a critical point that many books, including 100 Questions and Answers About Melanoma by Edward F. McClay, make clear: melanomas can start small. So don't wait for a spot to become large. If it's new, or changing, and it's the size of a pea or bigger, get it checked. Even smaller than that, if it shows any of the other letters, pay attention. E stands for evolution. This is the most important letter of all. A normal mole sits there, year after year, unchanging. But melanoma evolves. It changes shape. It grows. It changes color. It might start itching, bleeding, or crusting. Even a spot that looks normal today but starts changing next month, that evolution is the biggest red flag. Now, you might be thinking, but doctor, I have many spots. Some are funny shaped. Some are different colors. Am I at risk? Let me ease your mind. Most moles are fine. But as we age past 60, the risk of melanoma does increase. Why? Because damage from the sun accumulates over a lifetime. It's like a bucket filling with water, one drop at a time. Each sunburn, each tan, each day working in the garden without protection adds a drop. And by the time we're older, that bucket can overflow. I want to give you numbers, because numbers are honest. According to the American Cancer Society, melanoma accounts for only about 1% of skin cancers, but it causes the vast majority of skin cancer deaths. Each year, over 100,000 new cases of melanoma are diagnosed in the United States alone. And the average age of diagnosis is 65. That means you or someone you know is in that exact window. Now, let me build a little healthy fear, not to scare you into helplessness, but to wake you up. Melanoma, if caught early, is almost always curable. When it's still just on the top layer of skin, what doctors call in situ, the 5-year survival rate is 99%. But if it grows deeper, if it spreads to lymph nodes or other organs, that number drops dramatically. That's why knowing the difference between a mole and melanoma is not just trivia. It could be the difference between a 5-minute skin check and years of chemotherapy. But here's where trust and hope come in. You have power. Real, practical power. Let me give you 3 simple actions you can take starting today. First, once a month, do a skin check at home. Use a full-length mirror. Look at your front, your back, your sides. Raise your arms and look at your armpits. Sit down and look at your legs, between your toes, the soles of your feet. Don't forget your scalp. You can use a hand mirror or ask a loved one. Look at your fingernails. Look at your lower back, where many melanomas hide. And as you look, run through ABCDE in your mind. If any spot looks suspicious, move to step 2. Step 2. See a dermatologist. Not your general doctor for a quick glance. A dermatologist. They have a tool called a dermatoscope, which magnifies the skin and lets them see structures invisible to the naked eye. They've been trained to spot the tiniest irregularities. Many skin cancers can be removed right in the office, in minutes, with little pain and a tiny scar. Step 3. Protect your skin going forward. This is the hopeful part. Even at 60, 70, 80 years old, protecting your skin reduces your risk of new melanomas. Wear a broad-spectrum sunscreen of SPF 30 or higher. Wear a wide-brimmed hat. Wear long sleeves if you'll be outside for hours. And avoid tanning beds completely, they are not safe at any age. Now, I know some of you are thinking, but I spent my whole life in the sun. When I was young, we used baby oil and iodine. We never wore sunscreen. The damage is done. Let me stop you right there. It's true that sun exposure over a lifetime adds up. But it's never too late to start protecting your skin. Research shows that regular sun protection in older adults can prevent new skin cancers and even allow some precancerous spots to fade. The skin is an amazing organ. It can repair some damage. And more importantly, every day you protect your skin is a day you are not adding more damage to the bucket. Let me tell you another story, this one from the book Saving Your Skin by Dr. Barney J. Kennett. A woman named Eleanor, age 72, had a small black spot on her cheek. She thought it was an age spot. But one day, her granddaughter said, "Grandma, that spot looks like a funny map." Eleanor remembered reading about the ABCDE rule in a pamphlet at her senior center. She looked closely. Asymmetry, yes. Irregular border, yes. 2 different shades of brown, yes. She went to her dermatologist. It was an early melanoma. They removed it in 15 minutes. No further treatment. No spread. That was 7 years ago. Eleanor is now 79 and still walks 3 miles every morning. She jokes that her granddaughter saved her life. But really, it was the knowledge. The simple, life-saving knowledge of knowing the difference. So let me ask you. When was the last time you really looked at your skin, not just a glance? A real, intentional, curious look. If you can't remember, then today is the day. After this video ends, go to a well-lit room. Take off your shirt if you can. Look at your arms. Your chest. Your back as best you can. Ask your spouse or a friend to look at your back and your scalp. And if you see anything that makes you pause, anything that fits even one of the ABCDE letters, do not wait. Do not say, "I'll mention it at my next physical in 6 months." Call a dermatologist tomorrow. And here's the hopeful truth. Most spots you worry about will turn out to be nothing. Benign. Harmless. Old age spots. Seborrheic keratosis. Freckles. But the few that are dangerous, you will find them early. And finding them early changes everything. I want to leave you with a final thought. Our skin is the largest organ we have. It protects us from heat, cold, germs, and injury. It wraps around everything we are. For 60, 70, 80 years or more, it has held us together. And it speaks to us through changes. A new spot. A changing mole. An itching patch. That's your skin talking. Please, listen to it. You don't need to be a doctor. You don't need to memorize medical textbooks. All you need is one word, ABCDE. And the courage to act when something doesn't look right. Thank you for spending this time with me today. You've taken a step that most people never take. You learn the difference between a mole and melanoma. That knowledge is now in your hands. Use it. Share it with your family, your friends, your neighbors. Because sometimes, the person who saves your life is you, standing in front of a mirror, paying attention. Now go. Look. And if you see something, say something. To your doctor. To yourself. To someone who loves you. Your skin will thank you. And so will the people who want you around for many more years to come.